Our case is about Jorge, a 37-year-old man who has been recently struggling with shortness of breath and low energy levels. He shows up to the emergency room with a nosebleed that has been going on non-stop for 2 days. He also tells his nurse that he's been struggling with an intermittent fever for about a week. So when he gets there, he gets a couple tests. The first test he gets is a blood test, which detects that he has low hemoglobin, a high white blood cell count, which is a common sign of leukemia, high percent blasts, which are immature cells, and a low platelet count. Then he gets a blood smear to further get an understanding of what he has, and it shows that the blasts that he had are promyelocytes, which are immature white blood cells. This indicates that he has AML, which is acute myeloid leukemia. Further genetic testing reveals that he has a translocation called PML-RARA, which is a genetic mutation, which is a fusion of the PML and RARA genes, which causes acute myeloid leukemia. This gene mutation is the etiology of his case. The pathogenesis is that this translocation blocks normal blood cell maturation, which is what eventually causes AML. In terms of treatment, his doctor tells him that he's a good candidate for all-trans-retinoic acid, ATRA, which is good at targeting the PML-RARA pathway of AML because it directly targets the blast cells and forces them to mature and differentiate properly as they should have in the first place. For his prognosis, it looks very good since he has no other risk factors. He's under the age of 65, has no previous blood disorders, and is a great ATRA candidate due to the etiology of his case. 3 years later, Jorge is in complete remission. Now, how could Jorge's case be different or affected by COVID-19? COVID-19 is a disease caused by the SARS-CoV-2 virus. It mainly affects the respiratory system, but also can have impacts on other body systems, including the immune system. Generally speaking, it causes symptoms of fever, fatigue, and coughing, but in immunocompromised individuals like Jorge, it can lead to more serious complications. If the case we presented were also in conjunction with COVID-19, some of the symptoms Jorge had could be explained and even further complicated by COVID. For example, the shortness of breath he had could be intensified by pneumonia or low oxygen delivery due to anemia, which would be caused by the inflammation of the respiratory system due to COVID infection, causing a low hemoglobin count, leading to less oxygen delivery to the blood. The persistent fever could also be caused by COVID and be misattributed to the AML. The bleeding that he experienced, such as his nosebleed, could worsen due to the inflammation of blood vessels commonly caused by COVID-19 infection. COVID would also suppress his immune system, leading to a weaker response to AML. Finally, COVID could have a more indirect impact in terms of delays in his treatment. Since some COVID symptoms could be deemed more severe than his AML, doctors and other healthcare workers would have to treat first COVID and then deal with managing his AML diagnosis.
AML is a cancer in the blood that leads to the overproduction of immature myeloid cells in bone marrow. It also reduces the production of red blood cells, platelets, and mature white blood cells, leading to anemia, increasing bleeding, and immune suppression. How COVID would impact the biochemical changes for someone like Jorge, who already has AML, and also gets infected by COVID, it can trigger a cytokine storm, which is an excessive immune response that would greatly increase inflammation and the release of IL-6 and IL-1 and TNF-A signals. This intense inflammation would further suppress bone marrow activity, worsening the anemia, thrombocytopenia, and immune suppression. Another impact of COVID would also be the increase in inflammatory and coagulation markers such as C-reactive proteins and D-dimers. This would increase Jorge's risk of blood clots, bleeding, and organ damage, all of which further compromise his already fragile biochemical balance. Morphological changes. In AML, the bone marrow becomes hypercellular and filled with immature myoblasts, making up more than 20% of marrow, displacing normal blood cell production. The architecture of the marrow is disrupted, and any healthy red blood cells, platelets, and mature white blood cells are significantly reduced. COVID's impact. In Jorge's case, COVID-19 can worsen the morphological changes by further suppressing bone marrow, increasing blast buildup, and worsening anemia, thrombocytopenia, and neutropenia. It may also trigger DIC, leading to abnormal clotting and bleeding. Functional changes. In AML, the overgrowth of immature myoblasts leads to many functional issues as well. Fatigue and weakness due to anemia, more prone to infection because of neutropenia, easy bruising and bleeding due to thrombocytopenia. How COVID would affect this. For Jorge, COVID-19 would worsen the functional changes in AML by increasing fatigue and breathing difficulties due to lung involvement and worsening anemia. His weakened immune system from neutropenia would also make it harder to fight off the virus, raising the risk of severe infection.
Therapies, interventions, and strategies to mitigate the impact of COVID-19 on AML patients. There are a few cautionary measures that could be taken, including hand hygiene and social distancing, masking in hospital settings, and limited interactions with possibly infectious individuals. In terms of antibiotics and antiviral medications, AML inherently causes bone marrow failure, reducing the production of working neutrophils and monocytes in the body. Antibiotics and antiviral medications have shown improvements in immunocompromised patients, with remdesivir inhibiting viral RNA-dependent RNA polymerase, slowing replication, and Paxlovid, which inhibits COVID-19 protease, preventing protein cleavage needed for replication. Another form would be intravenous immunoglobulin, which AML and COVID-19 can raise the risk of thromboembolism due to increased D-dimer levels, endothelial damage, and platelet imbalances. Since AML can infect B-cell function, IVIG can be used to support the immune system in people with damaged antibodies. Along with this, vaccines like AML patients can benefit from mRNA vaccines since most patients have blunted T-cell and B-cell responses due to chemotherapy. In terms of preventative measures, bone marrow transplants can also be done for cancer patients who have been affected by AML and contract COVID-19. Bone marrow transplants and surgeries may need to be suspended due to the effects of infection. Procedures can be risky and even cause death due to the body rejecting the new tissues since it is already infected. Patients with cancer might also need psychological help because people with AML might have difficult times coping with the trauma of cancer symptoms. They also might need psychological help or mental health support. For psychological support related to cancer, the Canadian Cancer Society offers a cancer information helpline at this number.
Analyzing Jorge's health through the medicine wheel and the implications of AML and COVID-19. Spiritually religious spaces may be closed or restricted due to lockdowns, which limit spiritual and religious support. The pandemic, as well as limited time from AML treatments, can cause a disconnection from culture and spiritual practices, leading to a lack of motivation or resilience. Emotionally, due to the pandemic, patients may experience a fear of medicine and healthcare professionals and may be hesitant to follow healthcare providers or seek treatment. Without this care, this can lead to worse medical cases and a higher risk of disease or cancers. Mentally, AML along with the pandemic are both very stressful situations with a lot of unknowns, and this can really negatively impact mental health. Additionally, limited social interactions and being unable to attend ceremonies may lead to loneliness and depression, overall impacting recovery of both COVID-19 and AML. Physically, there may be limited community, family, and social interactions due to social distancing and lockdowns, as well as a reduced mobility and fitness. This can directly impact health and recovery, as well as physical strength and resilience. Limited physical access to healthcare and resources can delay or complicate treatments. This also limits testing and screenings to prevent diseases and cancers like AML in the first place. However, looking at awareness and prevention, one aspect or one positive to COVID-19 may be an increase in online education and awareness, as everyone may be more online and more on their devices during this time. Jorge's experience with AML and COVID-19 underscores the importance of addressing his health through the medicine wheel framework, emphasizing the need of a holistic approach that considers his spiritual, physical, mental, and emotional well-being.